My name's Christina Pahalski, and I have had the privilege of serving as the chair of our Fetzer Advisory Council, our Health FAC. Our Health FAC was very moved by the harshness of our current healthcare systems, not only in the US, but globally, where patients and families are often isolated and alone in their suffering, and caregivers are stressed and unable to show the love that is within their heart, unable to express and find forgiveness, and unable to express gratitude. Our call to serve others was inspired by each of our passions to see more holistic and caring systems. It has been a privilege for me to walk this path of our Fetzer journey. I want to thank each of you, my FAC members, for your commitment and dedication to bring love and forgiveness to healthcare all over the world. Our program today starts with two short plays that were written by Elizabeth Diggs, a playwright and a professor of literature at Columbia University in New York in the United States. The first scene depicts an all too familiar, unfortunately, scene in today's healthcare setting. The second scene is our vision for a better, more holistic healthcare encounter. We will then show a film that became a group project for our whole group that was scripted to our call and interspersed with highlights of some of our projects.
How are you?
I'm a little nervous. You called me in early. Is something wrong?
Well, the biopsy shows that the lump in your breast has to be removed. It's malignant, but the lump is small. You may decide not to have reconstructive surgery, but you can discuss that with your surgeon.
Is this malignant? Is this cancer?
Yeah, that's right. We don't know much more about it until the tissue around the lump is removed and the pathologist examines it, but you have some decisions you need to make now.
What kind of decisions? What do you mean? I never thought I would have cancer. I've had biopsies. You know that. I've had 3 biopsies. They've all been normal.
Yeah, I see that here, but history of cancer doesn't preclude a diagnosis of cancer. I see here that you had hormone replacement therapy. You were on a high dose for almost 10 years.
Don't you remember you prescribed that for me? I was to help with the symptoms. You told me that they didn't go away. You told me to double the dose.
Yeah, but I have a note here that says you were having trouble sleeping. You felt depressed.
Well, I thought it was menopause, and I thought menopause would be a couple of months or maybe a year. I was stunned that it could go on for years and years.
Yeah.
I thought the hormone replacement was the godsend that would help me. Is that what caused the cancer?
Well, new protocol advises patients to stay on HRT no more than a couple years. Now we recommend you take lower doses. But I need to tell you about the next steps that you need to take. You need to get in touch with the surgeon. Here are 3 names of some doctors you might want to see. I
don't know. What would you recommend? Which hospital is the best to go to? How do you make these decisions?
Well, all these hospitals are excellent. If you want to be in the neighborhood, St. Iglesias is a good one. It's close. You'll need radiation, possibly chemotherapy.
What doctor would you choose?
Well, I guess I choose Dr. Axelrod, but she may be completely booked. She's very popular now.
Well, I do know somebody who used her and liked her very much. Axelrod. I'll take Dr. Axelrod. Is there any chance the biopsy is a mistake? My breasts have always been lumpy, always.
Yeah, but the lab is quite reliable. If you're anxious, as you seem to be, you may want to see a therapist. I'll give you a prescription if you want. Do you have a husband or a partner?
I have a husband. Oh, God, how am I going to tell him? How am I going to tell the family?
I'll give you a prescription for Valium if you want. You ever taken it?
No, I've never taken anything like that. I can't tell my husband. What am I going to do?
Well, there's a brochure out at the front desk there. It's true stories about women who've survived breast cancer. It's information. You can review it at home. Do you have friends who are survivors?
Yeah, I do. I think so. I had a friend who did the Run for the Cure once, and I did that. And I was a sponsor one year, so I know a little bit about it, but I didn't want to wear those pink ribbons. It made me keep thinking about my good friend Deborah, who died of cancer.
Well, I'm sorry, but the success rate's getting better all the time. Of course, it depends on how advanced the cancer is and what type.
What do you mean, what type? I thought cancer was cancer.
Well, some cancers are more aggressive than others. Let's see. You'll know more after the lump's removed and the tissue's analyzed. The surgeon will discuss all this with you, and as well as your options.
What do you mean, options? Whether I live or die?
Well, be sure to have your surgeon get in touch with me as soon as you make a decision, okay?
Is that all?
For now, yeah. You have any more questions?
No.
Don't worry, Emily. Best of luck to you.
Emily, hi, how are you?
Oh, I'm a little nervous. You call me in early. You never do that. I'm a little worried. Is something wrong?
Well, I do have some difficult news for you. The biopsy did turn out positive.
Oh no, that's awful. I was afraid this was going to happen.
Yeah. I can imagine this must be really, really difficult for you right now.
I don't know if you remember, but my mother had breast cancer. My mother had breast cancer twice, and so did my aunt.
Can you remind me when this was?
It's almost 20 years ago. She was very young. She was 59. It was,
Yeah. That must have been very hard for you and for her.
Well, it was. It took almost 2 years. It went very fast, but it took 2 years. She was in terrible pain. And she kept wanting to go home, and 20 years ago, we didn't have much to go home with. And she just was in agony. She was. She had to go back to the hospital, and then she kept begging to come home. She wanted to be back at the house when the lilacs bloomed. She loved her garden.
So she had a garden?
She did.
Yeah.
She did. After she moved, I moved that very lilac bush and took it to my house and put it in my garden.
Oh, what a beautiful connection that is. It must have been very, very special for you.
Oh, now I've got to face this. It's really hard. I don't know how. I don't know how I'm going to do this.
Yeah. Well, I know that when your mom was really ill, that was a difficult time for you. And what helped you during that time get through the difficulty?
Well, our family came together, which helped, and I was really helping to take care of the garden, being outside. The garden still connects me to her. It's a spiritual kind of thing now.
A spiritual thing. Can you tell me a little bit more about that?
Well, I've always found peace in nature, even when I was younger, and after all of this, the garden and all of that, I sense my mother's presence there. It's the energy. It's bigger than me. It's something there, and I only started my garden after she died, so all of this was there. I feel restful there. Sometimes I meditate there, and I'm not the kind of person to meditate. I had to learn all of that. And it sort of keeps my mother alive in my thoughts. So I do. I find it very comforting.
It's really beautiful. Very, very beautiful. It also sounds as if family is important to you, too. Were they able to support you?
Well, my sister, I have one sister, a younger sister, who was very helpful. Of course, it was a shock for her too. And and my husband was wonderful. We hadn't been married very long, and so we were young. And really, when we all think back on it, the best thing was our first child. Sam was born then, just before my mother died. He was only 4 months old, and I was nursing him, and, you know, at least for me, I was doing something for someone very basic that I could provide. Even though I couldn't help my mother, I felt like, you know, I was helping Sam.
So Emily, was your mom able to see her grandson?
Oh, that was part of the wonderful part. Yes, he was born just in time, and she was well enough. And holding him really made her happy. It was one of those few quiet moments when you forget the pain.
Yeah. What a gift. What a gift that was, that you were able to give her, you know,
Yes.
give her life, and what a connection that must have been.
You know, I think so. I think she was really grateful. I think that time to connect with him and the next generation, and he's such a beautiful person, such a wonderful young man. Both my husband and I feel blessed.
I can imagine. You know, in knowing you as long as I have,
Yes.
but also in hearing this story today, it sounds as if you're really surrounded by love.
I am, much more than many people, and I think it will help.
Yeah. So even, you know, in the wake of having to deal with this difficult news, the resources and all of that you have right now are really, really important for you.
Yes.
You know, there have been tremendous advances in cancer since your mom had cancer. And there's a lot of hope, a lot of options for women to do very well with the cancer.
Do you really think I'll survive?
You know, I do, Emily.
Thank you.
And
But I think so. I think so too. But you know, my breasts have been lumpy all the time, and the lump wasn't very big. Does that matter? Will it help?
well, I think we caught it pretty early, and that, you know, generally means that if we catch it early, the cancer hasn't spread, and, you know, we'll certainly know more with more tests, but I feel very optimistic that we caught it early.
Okay. Okay.
So, are you ready to start thinking about choosing a surgeon, maybe?
Well, yeah. Tell me some.
Okay. Well, here's a list, and they're all women. Is that your preference?
It is. It is. I'd like to have a woman surgeon.
Yeah. My first choice would be Rachel Marcus. She's excellent, but the other two are excellent as well. And, you know, I'd be happy to help make connection for you. You can think about that. And
Okay. Now, you know, I really feel grateful that you found the lump. And you know, I always examine my breast, and it's still such a surprise that I didn't feel anything, but you did. I'm just in shock with all of this.
Well, yes, you know, we did on the exam find your lump, but it's a partnership, you know. You right away got your mammogram, you right away got your biopsy done, you're very proactive, so, you know, we're doing this together. And we're gonna continue doing this together, Emily.
Okay. Good.
So I think, you know, as I said earlier, I think you have a lot of strong resources. I think we caught it earlier. So I feel, you know, optimistic.
I think you're right. I'm feeling a little better, and I do feel hopeful, and you know, I do look forward to the spring and the garden, and that'll have to be a part of all this too.
Exactly, exactly. So we talked about a lot of information today, and I know it's been, you know, crammed. And do you have any other questions for me?
At this time, I feel like things are pretty clear. I do want, you know, to go home and talk to my husband and start to decide about this and decide on the surgeon and all of that.
So Emily, I've written my cell phone down here. And tonight, when you go home and talk to your husband, and it's very normal for questions to start coming up. So if you have questions, just call me, and I really want to hear from you. And I'll be happy to talk with you. And then I also think that you should set up an appointment to see me next week. And please bring your husband if you'd like to.
Is that okay?
Absolutely. Oh, absolutely. Your husband, anyone that's of support to you, I would welcome in our office. And we can talk about next steps. And then I do encourage that you try to select a surgeon and set up an appointment. I think that would be really important to do.
Okay, I'll do that. And thank you very much for the cell phone. You know, I don't know where we'll be in a couple of hours, but I'll go home and I'll talk with my husband. And I think you will come to the next visit, if that's okay.
Great. I really look forward to seeing you, Emily. And we'll do this together.
Thank you.
Okay.
Thanks.
That's great.
John E. Fetzer once said that loving concern is the one ingredient that can make us successful. It's the glue that binds us together.
We at Fetzer are about transforming the world. And we believe that through the power of love and forgiveness, we can achieve that kind of transformation.
People's emotional and spiritual well-being affects their physical health. And so that's really where love and forgiveness needs to be addressed, to be sure that we're not only taking care of a part of the body that may not be functioning properly, but also helping the person to come to peace of mind and peace of heart.
We're dealing on a daily basis on life and death issues, where a small piece of love can actually help reduce so much pain.
If we want our healthcare professionals to really have the ability to be compassionate in that exam room, they need to do some work on themselves. And it's not just, did I put the stethoscope on the chest wall in the right way, but did I listen to the story in the right way? Was I fully respectful of that patient? Did I honor their dignity? Am I concerned about justice? Do I care for the other person and put their needs above my own at that moment?
And I think that is where you consider the person first as a human, first as somebody you care about, somebody you love, and somebody you want to get better, and you want to find a way, even despite you may not even have the solution for that person, but how you relate with that person making a big difference.
Certainly we can't make everything come out the way we want to. And those levels of disappointment and forgiving ourselves for not being perfect, forgiving the whole organizational structure for not being perfect. But to be able then to say, well, I can forgive. I can forgive myself, and then be able to be strong enough and refreshed and able to go forward with that.
The most moving moments occur when we're hearing the stories of the people in the field, and we bring those stories from our own experience in the field. And then we're able to really discuss why this person or this group is an exemplar for spreading love and forgiveness. For example, I know very well an HIV and AIDS program for mothers and children in Vietnam. Many of them had been abandoned by their families. There's a young priest there, Father John Twy, who developed this program. And in the beginning, he had no medications, and so they and their children were dying very quickly. And yet they received comfort and care and acceptance by Father John in this program. It's called the My Tom Center, the House of Hope. Now, the women and the children are able to get some medications, and so they're living. And I love when I visit the house there because the children come back from school with their backpacks and their school books. They're facing a whole new life.
One of our exemplars is an amazing project in Haiti. I think what moved me most when I heard about it was the story of the woman, Lucy, who was the driving force behind it, and her real commitment to try to do something to improve the health care of people in Haiti. And so she gathered women around her, and they do arts and crafts, and then from the sales of that work, they're able to take that money and donate it for healthcare clinics. Instead of sitting with such tremendous grief and loss and a feeling of emptiness, they can actually fill themselves with loving others.
There's a World Health Organization definition of health, which includes physical, mental, spiritual, emotional, economic health. I mean, that's our vision of health.
People feel better and do better in health education and other factors in their lives when they are part of a community, when they have a voice, when they have the ability to advocate for themselves.
And we try to make this institution as much the communities as possible. So some of our folks work on the community garden and some work in the schools. We try to make it so that everybody has a sense of the people of the community other than when they're coming to you because they don't feel good.
It's very important that we create these spaces where people can come together and learn from each other.
Artwork, it's for the heart.
Absolutely. And when they reflected, the seniors get a chance to reflect about what the experience was like?
They say, well, we're ready to make more.
Coming to the center provides space for them to celebrate their successes, but also support one another in times when some of them describe having to go through cancer treatment and losing a spouse. And they were describing happily what it felt like to be part of an extended family. There's this word in Spanish, confianza, and that is beyond trust. It's beyond sort of liking you. It's beyond, we're friends. There's this sense of I can depend on you and you can depend on me. I see love every day in this work because folks sort of adopt each other.
People coming together, people respecting each other, people working with each other for the common good. That's love. That's what I care about.
Well, I do think love and forgiveness are going to be fundamental if we're going to make huge changes, because the changes we're going to have to make are going to involve working across lines, whether they're country-based or religious-based or economically based, and it's going to change our priorities. If we really want to get basic health care around the world, which we could do with a relatively modest reallocation of resources.
The health minister on their own cannot solve the problem. The same way that the practitioner, the nurse and the doctor or physician cannot solve it. It's all of us. And that is what is a call to the world. It's not called to the minister. It's not called to just the president. It's called to all of us.
And imagine, right now we have a council of 16 people. Well, what if after the meeting in September in Assisi, we have 100? And what if those 100 then impact another 1,000? That's how change occurs. And I truly believe that we can heal healthcare and the world if we can take on these principles of love, forgiveness, compassion, a real spiritual view to how we deal with each other and how we deal with healthcare.